Some people think if you get sick after being vaccinated, the vaccine has failed, but that's not true.
The goal of vaccination is to reduce the severity of disease in almost all vaccines in use and not to prevent infection entirely.
Several studies show the chances of being hospitalized or dying from COVID-19 are severely reduced for people who are vaccinated. The oldest vaccine making methods use either a live virus or a dead one to spark an immune response. Different polio vaccines have used both. 3 COVID-19 vaccines use weakened adenoviruses, which are viruses that cause colds. The Oxford AstraZeneca vaccine uses a chimpanzee adenovirus that has been weakened so it can't make people sick. Sputnik V and the Johnson & Johnson vaccine use weakened human adenoviruses that can cause colds. The American Society for Gene and Cell Therapy explains how scientists make these vaccines. Scientists removed the gene from the coronavirus's spike protein and put it into the adenoviruses. They also removed the gene in the adenovirus that can cause illness. Think of the adenovirus as an envelope with a message inside. The message tells the cells to make the spike protein. The body makes antibodies to defend itself. If it sees the spike protein again, the body is prepared to attack.
You don't just mount an immune response to the adenovirus, but you also mount the immune response to the protein that it encodes, that spike protein that is part of the virus causing COVID.
Both Johnson & Johnson and Sputnik V's first doses are made with a rare human adenovirus, AD25. Johnson & Johnson used to be considered a one-dose vaccine, but in October, the U.S. Food and Drug Administration's advisory board recommended that a booster be used to increase its effectiveness. The second dose of Sputnik V contains AD5, an adenovirus people are frequently exposed to. Scientists are concerned that Sputnik V doesn't offer enough protection against COVID-19. There are other ways to make vaccines that do not use viruses or bacteria, what scientists call pathogens, that could cause disease. The latest method involves messenger RNA vaccines, or mRNA vaccines, which are produced by Moderna and Pfizer-BioNTech.
They use techniques to trick the immune system into thinking it's seeing a pathogen without actually providing most of or all of the pathogen.
The side effects can include mild soreness, muscle pain, and fatigue.
There are some reports of things like a fever, some nausea, but all of these things can be supported at home.
Rest, fluids, and non-prescription pain relievers should help. Cox says it's not surprising that researchers could develop mRNA vaccines against COVID-19 so quickly. COVID-19 isn't the first attempt at using this technology.
These vaccines could be developed very rapidly because they had been testing vaccines using this strategy against other pathogens.
Just drop your shoulder for me, relax. Yeah.
There's an advantage of having so many vaccines against COVID-19.
Sorry.
The whole world needs to be vaccinated. Hondurans are even willing to cross a river to get the vaccine in neighboring Nicaragua. Another advantage is that scientists might be able to figure out which vaccines work best for different people. Carol Pearson, VOA News.